Hey everyone, it's Michael here at Home Health Success Academy, and welcome to another one of our Home Health Success podcasts, where we bring people who have been in the home health and the home care industry to be able to share with you guys amazing information and stories about their position in this industry. And so without further ado, I want to be able to welcome you someone who's been in this industry for over 10 years and would love to be able to share some information about her. So, instead of myself introducing her, let me go ahead and have her introduce herself. Just to let you know, this podcast is brought to you by Medication Reminder Program, giving you the one up from the competition. If you provide a medication reminder program for your services, it's going to be able to make you stand out and get you more referrals. Also brought to you by HomeCareAnsweringService.com, which takes care of all your answering for your home care services, home health agency, and hospice 24/7, 365 days out of the year, and even during the holidays. So let us handle all your phone calls, even those late night calls, and stop missing those calls. And of course, 10xpatientreferrals.com provides you all the training you need to be able to be great at marketing your home health, home care, and hospice services. So let's go ahead and get started with this podcast. Hey everyone, it's Michael here at Home Health Success Academy, and welcome to one of our new podcast video series. And so we want to be able to bring you guys some like-minded individuals that's going to be able to help you, especially you're starting to get into this home care, home health industry. So before everything starts, let me just go ahead and have her introduce herself. So our guest today is Therese right here. Go ahead.
Hi, I am Terrace Foster. My company is Nexus Management and Consulting and Nexus Back Office Support from Indiana. I've been in the home health industry for probably 9 years now. My husband and I actually had owned our own agency that we had recently just sold, had both home health and home care private duty. So that is just me in a nutshell and what I can offer to your audience today.
Awesome, awesome. So, just talk about Nexus, so that's your new venture going on right now, right?
Yes.
So, what's the main objective of Nexus, that's going to be for this industry?
So Nexus Back Office Support is it is just that, a back office organization that is established to help the home care agency scale operations. So we're focusing on things like that quality assurance, the quality review of documents, OASIS review, billing, revenue cycle management. So everything from claim submission through the collections and accounts receivable process. And then we also have another core component for education where we'll actually set up to teach others how to start their own home health agencies and home care agencies, walking them through that process step by step, and even offering that one-on-one consultantship where we can be there, walking you all the way through that process and making sure that we're applying some of our same knowledge and expertise to getting you approved, because we know that regulation can definitely hinder some of that process and scare people. So because we've been through it time and time again, we are there to assist the person that's interested in starting a business in this area and helping them move along that process as well.
So would you say that you guys can, provide services not just in your state, but as well as, all throughout the United States as well?
Absolutely. We are able to, obviously, when it comes to billing, OASIS review, visit notes, and compliance, that is national. I mean, the standards are pretty much the same, particularly if you are a home care agency. They don't differ too much from one Medicaid agency to another. There may be some different stipulations, but being able to provide that service nationwide and help assisting you in that process is definitely a part of what we offer. There are some things that we're probably more adept to, being that we are located in Indiana, but other than that, the home health industry itself has a lot of things. We also have familiarity with the CHAP regulations. So for anybody who is interested in CHAP accreditation, we can definitely hone in on that process because we have full understanding and expertise in that area as well.
So you love CHAPS more than JACO or the ACHC type of a setup? It's okay. I'm just saying.
You know what? CHAP was good to us. I definitely love their program. From what I hear about JACO, and this is just kind of coming from others that have been a part of JACO, because it tends to focus more on the hospital-based industries, it favors that. And so for the smaller agency like ourselves, it becomes a much more difficult to get through that process. And then some of the agencies that I know that went through JACO did not feel like they got that consultancy approach. With CHAP, we always felt like when they were there, whether they were there for survey or something else, we always felt like they were trying to help us, you know, in our best interest. Within reason, obviously, they have a job to do as well, but they were there making sure that we got the bang for our buck. Like, it was like, we're going to take care of you. We want to teach you how to do this as well. So that's what, for us, it tended to work better. And I actually had quite a few clients in this area that took to that. They liked the CHAP perspective, particularly for that smaller agency. It just seemed JACO was just big. And I'm not saying, you know, I don't think there was any negative. I just think for the smaller agency, that was kind of the complaint I tended to hear over and over again, was that they focused to that hospital-based industry.
I've actually seen a lot of home health agencies starting to transition. They started off with JACO, or they're state certified, you know, and then they're transitioning now to CHAPS, you know. I mean, especially the portal CHAPS, I do like their portal when you're trying to do
their portal is awesome.
It's like when I see the JACO's portal, I'm thinking it's like Windows 95. The CHAPS portal, I'm like, okay, this is like a lot more new in the 2000s type of a setup, you know. So, but yeah.
I can imagine. Yeah, and ACHC, I'm not as familiar with them. I do have a client right now that I'm working with that is using all of the ACHC model. So it's just a learning curve for me. I'm not sure about them as much. So we'll see. Hopefully in the near future, I'll be able to find out a little bit more about how they operate and how I like them as opposed to CHAP.
The only time I've seen ACHC is when I'm in one of those conventions and stuff like that. I have not seen anybody yet with them. So I mean, I know they're
really
block. So I you know, even myself, I have no familiarity with it. But you know, so you talk about that's the home health part that you're doing, but the startup, for example, for any agencies, you can also do it all the way through all over the U.S., right?
Absolutely. Absolutely. So definitely with that Medicare certification, walking through that process all the way from, I'll even go so far as even helping you set up your business entity. I know that, you know, starting companies and entrepreneurship is the big deal right now, and I am all for it. I love it. I love anybody that wants to get into this space. But it is, you know, it's a process, and legal forms tend to scare people. And so sometimes just being able to have a partner that can help them walk through that process from beginning to end is good to have.
Yeah, I mean, other than you know, going into what we're doing right now in regards to the industry at this very moment. So like, you know, you yourself, what's your background that made you feel that you wanted to jump into the home health and home care industry? Because what's amazing is you did both. You're doing both non-medical private duty, right? And a lot of the, you know, and also the medical part, the skilled nursing and everything. And I really don't understand why a lot of agencies don't look at the both models and offer both of those, because those are two separate revenues, or, you know, streams that
absolutely
get, right? So, you know, what was the point that you said yourself, you know what, we're getting into business? Like, did you
backing
home health?
Yeah, backing up a little bit. You know, I actually started in kind of the healthcare compliance field. When I initially started, I was doing that back office thing. So billing, insurance credentialing. I worked in various medical offices, and I did everything. And I started about 15, 16 years ago now. So that was kind of how things transitioned. I ended up graduating and getting my paralegal degree because I was definitely into my bachelor's degree in paralegal studies. I was definitely into the regulatory compliance aspect of that. So getting that degree helped me further my career in that medical compliance field. I even worked in mobile dentistry for some time. So I've kind of done it across the spectrum of medical and healthcare. I think I started in the industry just when HIPAA was being signed and getting really gaining traction. And so I always tell people I grew up with HIPAA. Like that's my thing. I grew up with it because it's been around as long as I've been working. However, getting into home health was a little different. I actually got into home health by way of my husband. My husband had already, I'm sorry, say that again?
You got dragged in by him?
Yeah, and I tell people that too.
Okay, so he dragged you in, right? He got
you
in, you know.
So yeah, when I met him, he was already starting the company, as far as being in the non-medical and the medical side. And I was immediately intrigued. Like, it was just something to it. I did not know that this sector of healthcare even existed. For as long as I've been working in healthcare compliance, I had no idea that it was around.
Okay.
So that was already the intriguing factor of it. And knowing that I had grandparents and aunts and uncles who were in that aging population, it just was like, hey, what's going on here? I didn't even know this existed. I didn't know this was a possibility. So as our relationship grew, I began helping him, what wives tend to do, back office kind of work. Oh, I'll do your billing for you. I'll help out. I'll get some marketing material typed up for you. And that's kind of what happened. I went through a space where I was leaving my corporate position. I had kind of was having some disagreement internally with the company that I was at about what they were bringing to the table. And I was already helping him. The company had started to grow. So we were kind of in transition and made a, decision that, okay, I'll come help with the company full time and work things out with you guys while we're kind of going through this transition phase of our life. Give it about 6 months, then I'll get back out into working in the field. 6 months felt like it turned into 9 years very quickly.
Okay.
I don't know what I was thinking about this a few days ago. I really don't know what happened. All of a sudden, I was over the entire operations process. Our company was growing very rapidly, and I was in it. Like there was no leaving at this point.
Got it.
So, but getting into it, you don't stick with something 9 years without falling in love with it. And one of the things that I think I really took to, I took to two things. Obviously, our patients, the people that we cared for. There was just something about being able to advocate for them. And understanding the rules, understanding the regulations, and knowing we had to play inside of those rules and regulations, but knowing that there was still a way. I think sometimes in the home health industry, something that tends to happen is we kind of get scared. Something's put out there, and there's no way. We put a stop to it. There's no way to do this. But then me kind of being who I am and being the advocate for the people, I was like, no, we got to figure something out. And so that became kind of our motto, became kind of how we built our company over 9 years at this point. And then it was kind of the same with home care. I mean, home care was there; they were subsidiaries of one another. So we just, I dived head first all the way into it, and it just didn't look back. And now it's like 9 years later, it's the best thing I've probably ever done. So
it's like a baby, right? Especially
absolutely
in the beginning, and then you build them up. But I mean, it's funny you said that, because my next question was, when you said, you had the home health and you had the home care component there. Like, did you put the application in for both of them? Did you go for both of them all at once, or did you kind of say, you know what, we're just going to do the non-medical first and then jump with the medical, or the medical then the non-medical? Which one was the direction that you guys did?
Well, here's a tidbit for those that are interested. We essentially, going into it, the whole game plan was to do both. That was from the beginning. But honestly, we separated the companies, and doing the home health, we knew was going to take longer. That process with CMS and all the different insurance payers and making sure that you can bill and that you are a certified agency that can provide services legally, that is a process. And it took, I want to say, from the time that he initially started application process to the time that he was able to bill for Medicare services, we're talking about 2.5 years. So at that, so it's a very long time. So ideally, my husband is the entrepreneur business mindset. So his idea was, okay, it doesn't take as long to get through that private duty spot, and it's a source of revenue. So that's where he started. It was a much smaller source of revenue, but it helped build the business. It helped get our name out there. It helped tell the community about us. And so those that were on service with us, even though there may not have been a lot, they were on service with us on our waiver side and our private duty side. Once home health was in full swing, it was just a natural transition. And so now you've got reciprocal referral sources. You have people who already know who you are and your name, and you've kind of already built your understanding of the industry and worked your way through it. So it was, for him, it was a logical way to do things. Start small, build your way up, because we knew going in that it was going to be a long process getting that healthcare application completed.
Exactly. I mean, 2.5 years for you guys. I mean, I remember the first agency that we had took us almost 2 years. And, a lot of people don't tell you that, especially when you just open up the business, you're like, okay, I'm going to provide quality care. Then all of a sudden they say you need your 10 patients. Right? And then you're just like, okay, that's easy. I can get, once you get to that point, you just need your 10 patients. Oh, I can do that. That's easy. Then it comes and you're just like, where's the patients coming from? And like,
Right.
it's like, that's one of the things that made me laugh. I was like, my parents were like trying to freak out. I was a travel nurse then. I'm like, I don't know anything about home health. I work in a hospital,
Mm-hmm.
we're just like, but they found a way. They were able to do that because they never did non-medical until I jumped into the company. So, I mean, yeah, so it's a lot of people don't understand it. It's going to take some money, not just time, the 2.5 years of the approval process, right? But
Absolutely.
there's money involved. I mean, if you're an RN or you're married to somebody who's a nurse and then you jump into the business, then you can kind of save costs. But if you're not, you have to cover a lot of those things.
Absolutely.
So like my mom, when they first started their agency, what ended up happening was she wasn't qualified to become the DON because she had no experience.
Mm-hmm.
So they had to pay somebody like pretty much part-time, paid them $32,000 a year for now, just for basic work for the first year. I mean, they went through $60,000 until they got approved, plus the administrator, plus all these additional fees and
Yep.
stuff like that. So, the fact that you guys did the non-medical, that's a smart move. And so for anybody out there that's listening, that's pretty much what we want them to understand, that, what you did is you pretty much warmed up the system pretty
Yeah,
much.
absolutely.
Allowed you to start marketing your products and services, really saying that we're doing this, so that you had the contacts. And then when you guys had the medical aspect of things, it just really launched from there.
Well, and then the most important piece to remember is the company is now generating revenue and able to support some of its endeavors that it needs, because sometimes, and we were, there was some money there, some capital that from some sales that were made prior, but it only took you so long. Like I said, 2.5 years. That's a long time to be waiting to get to a point to where you can build your primary insurance source and be able to collect on that. So when you think about it from that perspective, you've got to have something that's generating money. Everybody doesn't go into it with just a $60,000, $70,000 sitting around waiting to pay all these people that still need to be paid for their services. So that was, I think I still to this day, and I'll tell people this every single day, that was probably the smartest move that we could have made, is making sure that we still had that revenue source. And in addition to the non-medical side, even though we had pushed our home health side, we still had our Medicaid portion as well. So that got approved a lot sooner than even Medicare got approved. So even though we were kind of moving in these steps and moving, and we knew Medicare was the ultimate goal, we didn't turn down the other options for us to collect revenue. And so the non-medical private duty waiver, Medicaid waiver side, and then you've got the regular traditional Medicaid for prior authorization, home health aid services. So all these things were a build up to the final ultimate goal, which helped carry the company while we were building it.
So when you finally got your Medicare approved for your company, did you still take care of your Medicaid patients? So did you still use that?
Yeah.
Perfect.
Yes, absolutely. And honestly, that was probably the thing. It's crazy because we kept telling people once we got approved for Medicare, we were gonna, we weren't gonna service as many Medicaid patients. What ended up happening with us is we ended up building in a dual eligible program.
Okay.
And it actually began to be kind of married into our footprint for the agency. And I promise several times we did try to get rid of it, disengaged, lower our census, and we couldn't. We just couldn't. The minute we would try, we started to lose on the other side as well, which meant we had built a program that pretty much combined the two. In our area, I'm not sure about many other areas, but in our area, there's really only about 3 to 5 agencies that have been able to successfully do that well, ours being one of them included. Most other people that have tried even have called us in to consult them on it. They're just not able to really grasp the concept. But I think it was how we started from the beginning for us. And most people don't realize how much that means to the elderly population. And reduces hospitalizations. Hospitalization reduction is the big buzzword right now. But so many people go back into the hospital because they don't have that continuous care of a home health aide coming into the home, or even a nurse coming in for med setup under the Medicaid benefit, even though Medicare doesn't pay for it. Mm-hmm. So we built built a model that actually it contributed heavily to our success. And like I said, I think even of the 3 or 4, 5 agencies, now that our agency has been sold off, I don't think the new agency is taking that on as well. And then some of the other agencies have kind of died off. So there may only be 1 or 2 still in the area that have really been able to maximize that dual eligible program very well.
Yeah, so that means when you have your staff and you were able to structure it where, you know, you can make sense of paying somebody to do visits at Medicaid patients, but at the same time as Medicare. Because a lot of times a lot of agencies, unfortunately, they base their pay and the way they structure the company is to only service Medicare patients. So they feel that when they do the Medicaid, you're taking a loss. And the truth is they just never adjusted correctly. They should have gone for the lower part because they want to pay nurses $100 of visits, even though it's not a start of care. And that's causing problems to them with the revenue. So I mean, so the model that you guys created is that kind of the setup that you have for your model on what you're teaching people to do when you're consulting them, or did you kind of adjust it as it goes pretty much?
It's adjusting as it goes. There's still kind of the idea of what people want to do. There comes a lot of responsibility and overhead that comes with servicing the Medicaid and the like home health aid only services, the low end of those services. So unless you have a system that is built for that to be able to accept that, it can go bad very quickly. So a lot of times I have one agency right now that they're pretty much building their agency in the same way we built ours. So they're starting on that low end first, and the goal is to later down the line get that Medicare, put back into it and work through that process. And so with them, yeah, I would definitely focus on that because I'm going to recognize, hey, listen, when you get to this point, even once you get your Medicare approved, you can't lose this because this is what built your company. This is going to be pretty much married into your framework. But then you have some agencies that are like, hey, let's invest. We've got the $70,000 put away for whatever we need. Let's go ahead and invest into it and let's just do straight Medicare. So I guess it's going to be adjusted based on what that agency wants. But I do believe it is a very good model. And when it comes to taking care of patients, it's something that can definitely be done very well. It's understanding the rules and regulations. It's understanding what is the low end, what's your low hanging fruit that you can go for. And it does understanding where you can fight and where you don't have to fight because it does take some extra work to navigate that appropriately and make sure that you're doing things correctly according to the rules and regulations of Medicare and Medicaid.
So, I don't know if you're like me, but for me, wise, I'm, one of my best friends owns his own home health agency, and we were competing in the same areas, right?
Okay.
And then as you start finding out, you're like, so-and-so we used to hang out in high school, they have a home health agency as well. And so all of a sudden you start finding out you're hanging around people that are your competition, right? But for you guys, did you hang around with a lot of people in the industry as well, in the home health industry that had an agency like you? Or was it like, keep them away?
Ideally, I know that once my husband decided he wanted to open the company, he actually got the idea off of a friend. So he had started kind of allowing that friend to mentor him, and they worked together. And he helped him, kind of build his agency up and get to that point. So we do find ourselves kind of in that same framework. It's funny because most people looking out from the outside looking in would automatically say, oh, you guys are in competition with each other and there's got to be some kind of animosity, but there's really not. You start realizing how much you actually need each other. And when the state comes in, or when the surveys are happening annually and you see somebody that hasn't done as well, it impacts you just as much. Like you look at it and you're like, whoa. Most people would look at it like, okay, I'm going to jump on that because we can get those clients and we can. But it does something to the community, and you feel it internally just as much as you would if you weren't in the industry and you're looking at a friend that may be losing their business. So ironically enough, yes, there's some actual healthy competition in the home health industry. So I would say that we found ourselves doing the same thing, hanging around a lot of the same people, connecting with a lot of the same people, and cheering for them when they win and, you know, being sad for them when they lose as well, because you recognize how much you need one another and how much you guys are working together towards the same common goal.
I mean, there was a couple agencies that we couldn't unfortunately get along every now and then, and that happens.
There's always one or two.
The facts, you know, saying, hey, we're taking your patient, all that stuff, right? So it's
right.
But, you know, like, you know, a couple of good friends of mine who did own home health agencies, we just pretty much kind of, even though we were in the same area, we joined up to go up against the larger guys.
Mm-hmm.
So it's like, you know, we're able to like jump in and say, hey, just when we market ourselves, say, hey, you got 3 agencies working for you. You know,
yeah.
We'll tell you have 3 agencies working for you. We cover every moment. You won't lose a chance. If a patient we can't cover, we'll make sure somebody else covers it. So we're able to do that. But there's that sense that once you get that account, you help each other out. You know, you count how many people gets in Medicare, who gets insurances, and you know, we just did it something like that, kind of making like your own little ACO type of a setup, accountable care organizations where we just helped each other out.
And building those relationships was really good for your business, because then instead of, like, I'm a big proponent, kind of, you know, when I started my career working completely, I started kind of in retail as an addition to the medical portion. So I'm a big proponent of customer service. And one of the things I hate telling people is I hate saying no. I hate not being able to have an option for you.
Got it.
And so if I'm in a position that I can't do it, being able to have another agency that says, you know what, let me call this agency if they have any more staff they can take this on, or if they have any room to take this on. That was an option that I was able to present to my clients. So that helped me. For me, I felt like that was a win, to be able to have those other agencies that I could call on in a minute and say, hey guys, you know,
Stuck there for a second. Sorry about that. I think we got stuck there for a second. I do apologize. Can you hear me now?
Yes, I can.
Sorry about that. But yeah, talk about customer service. If you look into the home health industry, what have you seen about, you know, because I know a lot of agencies that have really bad customer service, like even phone skills. Like I'll call.
Oh my goodness.
And I'll have, you know, I understand it's a husband and wife business, but then what is your husband doing if he's not picking up the phone, if it doesn't know how to pick up the phone? Like,
absolutely.
Does that ever happen to you where you come across agencies that they don't really focus on the customer, you know, customer centric type of a services? It's just pretty much healthcare, medical. They forget the customer aspects. Like what's a story?
There is a misconception in our agency, in our industry, that to do as much. Like, the clients are going to come anyway. They need us. We don't need them. And I see it more than not, and it is the most frustrating thing to see, because there's nothing like referring a client somewhere and then getting a call back that says, remember that agency you referred me to? Well, I didn't like how they approached me, and they didn't announce themselves at the door when they showed up. The first and foremost, I need everybody to understand is that you have to remember that just because you are providing a definitely necessary service, these elderly individuals are still entitled to their space, and they are still entitled to the respect of their home. That is the first thing I teach my team. Do not go anywhere without making a call first. I got more complaints about people showing up without calling than anything else. It's the same. And I would have to bring it to them. If you showed up at your grandmother's house without announcing yourself or without calling, what is she going to do? And the first thing they would always tell me, she'd go off. It's the same principle. You cannot do this. They're not, that you have to understand they're living, some of them are living alone. Their caregivers may be at work. So they have to be extremely cautious about the people they let in their home. And you have to think about what their mindset is. They cannot defend themselves, or they can't jump at the chance to fight you like they would if they were 25 or 30 again. It's not the same. So they have to be cautious. They have to use their mind in order to protect themselves, which means they may be asking you more questions, which means they want the respect of you just calling them and saying, hey, I've got an extra space today. Instead of coming tomorrow, can I come today? Give them that courtesy. Give them that knowledge. Phone etiquette. We actually had in our agency, we set a standard. Like there was a specific greeting when you call our agency that you would hear, and you got trained on it. And if you walk past a desk, and if I walk past a desk and I heard you say something else, like I'm going to stop you right then and here. Here is our greeting. Let's repeat this again. And time and time again, even those that had been in home care for years, they couldn't understand it. And I finally had to break it down to them and say, guys, there is an expectation that our clients expect of us. They know when our aides or our nurses walk in the door, if they're not dressed the appropriate way, I'm going to get those calls because they know what this agency is supposed to look like when they walk in the home. When you don't answer the phone a certain way, I'm going to get those calls because there's a level of expectation that we have established with our clients, and they want this from you. So it is imperative that we give that to them. And sometimes you have to slow down and just listen. You have to listen. They just want to be heard. Well, they're complaining about this and they don't want that. Sometimes they just want to be heard. You've got to imagine, their caregivers may not be showing up every day. They may not have family coming to see them. They're lonely. They have no one else to call but their home care agency. So you may have to slow down and just give them that chance to listen to you, because they're a customer just like everybody else. And just like everybody else, they have the choice to leave. And you have to remember that. And if they decide to use and utilize that choice, then what are you going to do about that? So the least you can do is pick up the phone appropriately. Call back when you say you're going to call back. Get them an answer to their question if you don't know the answer. These are just basic things. And a lot of times, one, I don't think that everybody is being trained the way that we were trained years ago. I actually was listening to a podcast, Disrupt Home Care. I cannot remember the CEO that was on, but she said the same thing. She said, I think it is vitally important that every one of my administrative team members have some sort of retail experience, because that's usually where they find out how to approach customers first. And when they don't have retail experience, she said, I'll go back 20 years. If you don't have retail experience, I find it hard to be able to trust that you understand what it takes to engage customers and treat them appropriately. And it makes perfect sense, because I feel the same way. A lot of those that were better, that I didn't have to train as hard, usually came from some background in retail. Others, we had to work a little harder at this to get you to a certain point.
You know, I mean, my background before I got into nursing was hotel business management. I was actually a supervisor for the Marriott hotels for the front desk. So that's where like I got my customer, service part of it. And it was like so weird how that kind of helped out on me becoming a better nurse. It's one of the weirdest things. And, because sometimes I do come across some nurses and everything, but that's funny that you said, you talking about you guys had scripts that you expected them to actually say when they picked up. I mean, what we ended up doing for a while there is we started doing a lot of tonality training, even just how they sound, the vocals,
Interesting.
We start talking about your tonality, your deflection, how you talk and stuff like that. If is it rapid, is it fast? Even your body positioning as well. Like it got to the point, like, around 4th year of our company where I was in it already, we actually put mirrors in the cubicles. We put a mirror right by their phones and our staff, and we said, listen, we want you to smile, every time that you're actually picking up the phone. Look at yourself. Is that the person you really want to be talking to in the other line? So it was kind of like just for the fun of it. But eventually everybody, like, a year later, you're like, where's your mirror? I'm like, I don't know. Like, it just, you still just have to monitor them, kind of how that goes. But, so you got the home health, you got the home care, so what then made you, because obviously people started asking you questions to help them, right? With their agencies, because they're seeing that you're doing good. They see that, your staff is doing better. So when you guys went to start your consulting business, how was that transition to go from like crazy heavy nonstop phone calls, right? To all of a sudden, like, all right, let's go to the next level, because it's always about improving yourselves and making yourself better, right? So absolutely. When you transitioned to that, was there a big like change? Was there like a big, the I feel good moment because now we get to rest a little bit? How was that?
It was bittersweet because there is the, I get to rest. But then there's the, oh my goodness, what do I do? Like, you literally don't know what to do next, because for at least the last 8 years, we're literally jumping up and hitting the ground running. Like, I mean, honestly, our kids would wake us up, and then the very next phone call would be somebody from work, something's going wrong. And so this was how it went for years. And then, surveys and end of years and end of month billing and all this other stuff that comes along with the hustle of home health. But there is, we obviously took some time to kind of debrief. What is it that we want to do? Where do we want to head next? What is it that we love about this? What is it that we dislike about this? And I think we are in that space where we found ourselves, even during the course of the time we were open, we found ourselves helping a lot of our friends, helping other people throughout the community, even going so much. I've done full EMR trainings and setups for EMRs that I wasn't using, but because I understand how EMRs work and what is required of them and what they need to be successful in their workflow process, then this was something that we were always doing. And so you get to the point now that we're like, okay, we've kind of reached this point in home health where we fully understand. I think it was a opportunity for us that happened, and we jumped right into it. But then it's also like, we know what other agencies go through. We know everything from what it takes to get this agency going, to not only that, but also being able to coach owners and administrators on how to operate, because we made so many mistakes in that process that cost us probably more headaches than we needed to have. And so then there's a lot of things that, as much as CMS is there to train you on how to make sure you meet their regulations, they're not going to train you on how to be a business owner.
Now, and we continue on to the video. Just need to be able to take a few seconds of your time.
This video is brought to you by MedicationReminderProgram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's MedicationReminderProgram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The Daily Reminder program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to MedicationReminderProgram.com right now. There's 3 packages available, but at the very same time, right now, with code 50 off, you can actually get 50% off our Gold plan and the Platinum plan. So just stop by MedicationReminderProgram.com and let us help you get more referrals. Let's go back to the video you're currently watching.
It doesn't come naturally. So there's a lot of lessons that we learned that I think that we feel now we can service a larger audience, and we can impact the community of people who want ownership, who want an opportunity to serve and to impact the community. And so we feel like there's something we have to offer that we are able to kind of help them avoid some of those pitfalls that we went through. And everybody's not going to listen. I understand that. You can take it or leave it.
And so it's good, for the smart entrepreneurs out there, for the smart business people, it's better to actually learn from the people that already made the mistakes than you it again, and then you're going to experience the cost. I mean, like, for example, you experienced, the pains, the things that happen, and it cost you your money. It cost you your, the time that you lost. And honestly, nowadays, time is really is worth more than money nowadays. And so, people forget that when you lose time, there's a lot of money that you lost right there. So, I mean, so it's good that to bring in people like, with your company and stuff like that, to be able to help everyone out. So it makes things go faster. And at the very same time, it's less expensive for them. So, I mean, for being and seeing other companies, what are like 3 things that you've seen a lot of people that start their own home care and their own home health agency? What are 3 things that really you've seen that they've made mistakes on or miscalculated?
I think the number one thing that owners, and I speak specifically of owners who do not have the clinical expertise to service their own DON. They may not even have the expertise now with the rules changing. They may not be able to even service their own administrator. The number one thing that I see is the leadership that they appoint in their place. They make the mistake of appointing somebody who doesn't have all the expertise. And I don't think that that's even required if the person has quality leadership skills. Those are skills that can lead others, can train and teach others. I see this time and time again, because if you are going to hand over the reins of your business to somebody else without taking into consideration that they literally have your life in their hands, whether, or, if they're going to do the right thing, if they're going to get you cited in a survey, if they're going to cause you to lose staff members because they're not operating with integrity, or they're not having the wherewithal to understand how to talk to people, period. I think that that's probably the number one thing that I see. So if you are going to appoint leadership that does not have those basic skills that you want to follow, that it's going to set you up. It's going to set you up for the long run. The other thing is being able to further enhance your own leadership skills. Because even during the time period where my husband and I could not serve as our own administrator, we had to constantly develop our own skills on what does it mean to lead others, and what does it mean to treat others and build a business, because we knew one day, we did want to serve as our own administrator. And two, we also knew that even while there was somebody else in the reins, we still own the company. It's still our company, and we still want the best outcome possible. So whoever had to be in that leadership role, we had to be able to trust enough to lead us to where we needed them to be, to where we wanted to be. And then we also had to trust that they were going to, the company was going to further enhance. It wasn't going to be like backwards movement. They got this leadership role. Oh, I meet the paper qualifications for this position, but I'm not really the person that others want to follow. And so now you're losing staff members, you're losing patients, the people that actually generate your money, because you have this one person or two people in these positions that they're not looking out for your best interest. They're not taking you to heart. Those are the number two things I even see now. If I have more conversations about proper leadership than I want to have. And, as much as I would love to just take all these positions over, I took a new position for a reason. So of course I can't, but I think I have more conversations about proper leadership than I should be having for anybody that wants to own a business. I told one owner, you did not go into business to be held hostage to your business. And if your leader is making you feel like that, that's the wrong person. That's the wrong person. That it should never be that position. You should never be in that position.
And it's funny you say that, because what they literally say. Some people say, "Well, I want to start my own business, my own company, right? Because I don't want to work for the man no more. I don't want to work for another person." And then they create this company, and it becomes just another job, just because their name is in the corporation papers. It's just another job for them that they have. Really, you have to be able to learn that at some point, if it's going to be a real business, you have to give it to another person to manage it.
Absolutely.
But that doesn't mean that you let it be. Because I know a lot of companies owners, sometimes they're like absentee owners. They somebody's running it to them, and then all of a sudden they jump back in and they say, "What happened to my business?" I'm like, well, you did not properly lead the company the right way. So it's like,
absolutely,
leadership is a good thing. But taking to marketing, like, what were like some marketing problems that you faced, like, or was that, did that come natural? Because you have the presence of being able to converse with people. So it's funny how I see a lot of agency owners, they start a business, and then when you ask them who's going to market it at first, and they say, well, not me. I'm like, well, who's going to be it? Because if it's not you and you're just starting it off, who's going to do it for you?
Who's going to do it? Absolutely. Marketing challenges early on, it wasn't, honestly, I don't think it ever was an issue. My husband and I, we kind of divided our roles. He was more the pushing the business development, building the brand, building the business. And so it was nothing for him. He'd see somebody, honestly, if you are leaving the hospital and you're rolling down to the bus stop in a wheelchair, like, he's running down there to meet you, because he's like, you need home care. What's going on? What happened? Well, I just got out the hospital. I got to catch the bus home. Somebody needs to help you, because if you're catching the bus home, you're not making it to that next doctor's appointment at hand. So, those were things that were just kind of easy. We kind of took, like I said earlier, we took that low-hanging fruit, and we always tried to figure out how can we help those people that were right in front of us. We used to brag that for the first maybe 4 years of our company's existence, we grew by word of mouth. everything we did was by word of mouth, and it was by, the quality care that we were providing, the customer service that they would receive when they came to talk to us. And just, the overall presence of, did I feel better? They kept me out of the hospital. They taught me how to do this, that, and the other. So that first few years, we didn't have any marketing apparatus. I mean, we had a website, but we weren't really putting it out there and really, making it known because it wasn't a big deal for us. So it's only been like the last 4 years that we really made that effort, wholeheartedly, and invested in the marketing apparatus, where we actually had a marketing team, and we started putting effort into our social media presence and our website and literature, having, printed literature that was constantly available. So from a marketing standpoint, it goes back to what we've discussed with customer service. Starting off those first few years, it was the easiest things that we could do, those baseline things that we could do that kept our name a positive name in the community. So when people talked about us, they weren't talking about how poorly they were treated. They were talking about how good this agency treated me, how much this agency respected me, how much they made sure that we, were taken care of. One of the rules we used to have, I see a lot, some agencies kind of have this standard for when a client doesn't get covered, particularly in the home health aid space, when they say, if we can't meet those hours. And it's not an emergent care, so it's not necessarily a requirement, but we have always, even before CMS changed the rules recently, we always had a standard that hours get covered. Like, we're gonna have those hours covered. It doesn't matter what's going on, you're going. So our staff coming in, this was part of the training process. Like, you have to understand, we're covering every single hour on our docket. We're not missing an hour. Those baseline things that we could do helped people give our name a positive light when they went to tell somebody else about us, which is one of the reasons why for 4 years we could go without having a true marketing apparatus, because we just covered the basic things, just the basic things that they needed to know that this agency versus agency B is going to make sure I have coverage regardless of what my home health aide is going to do. So those were just some of the basic things that we did to make sure that we stood out among the crowd.
That's amazing. So, for your, your consulting company right now, like, what's your ideal client that you guys want? Like, because a lot of companies feel that there's nothing wrong with them. And sometimes there's nothing wrong with my company. And all of a sudden you jump in and you're like, yeah, we can have to talk about certain things, right? So, like, what are the on the face that, when you're trying to get these clients, that really is where you need to concentrate more on?
So
right? Other than leadership. I mean, of course that's important. But
absolutely,
that's hard to be like, tell a person like, you're a bad leader.
We've got to work on some things. Yeah. Honestly, I tend to focus on operational aspect of companies. One thing that you'll see, and I was actually talking, our old clinical consultant, she and I have become really good friends over the years. And I called her a few weeks ago, and we were actually talking because we were talking about how many consultants out there are clinically focused. When you hire a consultant in home health, you will find so many of them coming in and they're focusing on, okay, is your documentation meet CMS regulations? Are you going to make sure you're going to get billed based on this documentation? And are you meeting some of those baseline, like infection control and emergency preparedness guidelines and all those things that are clinically focused? But nobody focuses on the operational component, the back office, and the kind of a workflow process of the home care agency. It was one of the frustrating things we had in our agency. Yes, I need a clinical consultant because I'm not a nurse, so I need somebody from the outside looking in. But we did a lot of the things we did well, and a lot of the things that contributed to our success was directly related to our workflow. How are we bringing in a customer? What does intake look like? How are we making sure that scheduling happens in that 48-hour requirement? How are we making sure that once scheduling takes place, that now that nurse has autonomy over managing her case effectively, and that we're communicating the things of this case, the way that it needs. So my ideal client, and even with the clients I work with now, is I'm focusing on that back office stuff. Like, I will tell them, you still need a clinical consultant because you still need somebody to look at those charts and make sure that those nurses are using their clinical skills appropriately. But what I want to focus on is how we streamline that workflow process and scale your business operations so that you get the maximized productivity out of all of your administrative staff, so that you can limit the overhead that you're bringing into your company, because we all know we don't get paid for the administrative work. So it ends up being more work or more money that we have to pour out for our company. But how can we streamline this and make it as easy as possible for the patient, and make sure that they're still receiving that quality care, but you're able to maximize your productivity and maximize the amount of profit you're receiving off of each patient because your workflow has been tightened. So I work with clients. That's how I pretty much consult with clients, is making sure that we're streamlining those workflow processes. How are we eliminating those things that are wasting our time and our energy in the back office?
What's your take on because for of course, if whoever's listening out there right now, we're talking about medical home health, for example, just for now, like the coding, for example, you have the belief that coding should be done in-house, or it should be, can be outsourced, because everyone has their own comments on that one. Like what has worked for you in the past? Have you ever have people code for you outside your facility and hired another company?
I think coding here's the thing about it. I think a lot of times what people say when they say code in-house is they have the understanding or the impression that coding is about choosing the diagnosis, which the nurse is going to do that anyway in the field. She's going to choose the diagnosis. Coding is about payment. Coding is about making sure that you are prioritizing your diagnosis codes appropriately, that you are using the appropriate code, as opposed to a nurse who may use a general code based on what she sees in front of her, but then an actual coder dives deeper and says, well, this is the code that is actually correct for this situation. And so I feel like it doesn't matter whether they're in-house or outhouse. Outsource. I don't think it's going to change either way. We use outsourcing coding, and it worked perfectly well for us. The key is, again, if you have a clinical manager who is making sure that those things are being, are overseen appropriately, and that we're not getting some left hand, some codes way from left field and documents aren't being checked appropriately, then obviously that becomes an issue. But I mean, we used it outsourcing and it worked perfectly fine for us. But I think a lot of times the misconception comes because they feel like if you have it in-house, well, then that person is there, they know what's going on, but it doesn't really change anything, because the nurse in the field is still going to choose the diagnosis regardless. It's just a matter of making sure you have the right diagnosis for the payment that you need to receive, and that coding order is accurate.
Is your company going to be offering these type of services?
Yes. So next is back office support. We'll offer coding services. We'll also offer that OASIS review and kind of 45 recommendation review, as well as billing. So we'll have that back-end billing completely from claims management or claims submission all the way through accounts receivable. So yeah, we'll offer both of those as well.
Awesome. So for you guys, I mean, are you guys going to charge like a typical, like, for example, you guys going to have, a retainer fee or something like that, or is it just going to be like a, monthly service type of a setup at, use as you go, or pretty much just like a, fee monthly so that they can keep you as retainer as a company?
It'd probably be start with retain. Well, it will be more of a retainer basis to start for the initial setup, and then it'd be the monthly service fee, or we'll kind of have a monthly charge. Well, the coding will be set up a little different than billing. Billing will probably be more on that monthly service fee, but the coding and OASIS review will probably be still based on per item, and then billed at either a weekly or a monthly basis. So we're still kind of figuring that out. But yeah, those are pretty much how we're probably going to handle that.
Yeah, I mean, it's important. Like I always tell people, like, there's nothing wrong having a biller outside biller. I mean, if you have less than 100 patients, there's no sense to have an in-house biller for you. I mean, that's just my belief on things. It's like, because why are you paying somebody $70,000 a year?
You're going to pay you're going to end up paying more money. And a lot of times, one of the things that I actually hope to have out this week is a comparison chart to show you, because I know what those costs are, to show you the difference in pricing so that you can understand just how much you're saving. Because your salary, it doesn't end with your salary when you hire an in-house biller. You've got salaries, you've got taxes, you've got insurance, you've got all these extra things. You've got the actual space that they need to operate in. Every seat requires more money. So there's a lot that goes into bringing in an in-house biller and charging all this money. And for less than that amount, you still get an outsourced biller who understands fully what to do, who can get a lot done. And we, like I said before, because our program has a communication basis where we're going to stay in contact with that client constantly. So we're going to let you know when there's a problem. We're going to work with your clinical team to get coding correct and to make sure that we get things resubmitted accurately. So we're going to operate like we're sitting right there with you. I mean, with technology today, there's no way that we can't.
I mean, and it's tax deductible because it's a service that you're paying out. You're not paying for the, you know, so a lot of people don't forget, I'm like, that's an expense that you're making. It's not an employee that you have to pay their, you know,
Absolutely.
and everything like that way. You outsource a service, even like consultants, like, you know, like yourself and myself. It's like people say, well, that, you know, the cost of, and I understand the cost, but guess what? Technically, it's a write-off for you.
Right.
You're making this much amount of money. What you're paying me, you can use it as a write-off for your company. So, you know, so technically, you're not paying me anything. You know, so
that's a great way of putting it. I'll use that one. You're not paying me anything.
If Uncle Sam's gonna take that money anyways, you might as well just say it's a service, and then. So I mean, that's just one of my objection blockers. But I mean, yeah, it's just it is good to be able to start looking at that. And a lot of people, what's funny is when they get their cost report, I know so many agencies that don't even read their cost report, and you just read it. It literally tells you the story of your company.
Exactly.
Exactly. Deposits in that Medicare or whoever writes a check deposits in your bank account. You know, look at really how much are you spending. I mean, some tweaks, and you know, sometimes a lot of people don't understand if they don't know how to do it. Seek help. Ask people that can help you, because if you can save some money because if you're fixing certain systems that you have in place in your office, you're going to save some money, which in the bottom line gets you more profit. So that's one thing. But you know, towards the end, let's go. Let me ask a few questions that just like rapid questions, kind of, and see.
Sure.
What's your favorite software?
You would ask me. My favorite software. Right now, I'm gonna have to say Home Care Home Base is my favorite.
And software. Second and third, just to just to be fun out there.
Second and third, I like Can Time for a smaller agency and Access for smaller agencies. So when you're starting off, I honestly, I'm a believer that an EMR is needed from day one.
Yes.
But when you're starting off, those are low-cost solutions that still meet many of the regulatory requirements with very minimal workarounds. Those two are probably still my running favorites. But other than that, Home Care Home Base definitely tops it out. But of course, that's an enterprise system. So once you reach a certain level, I'd say once you get over 100 patients, it's definitely one to look into. They're costly, but it is an investment that is definitely worth it.
But going back to what you do as a consultant, right? You know, it's having a system that's going to work, that's going to save you time. The time that you save is money that you earn, pretty much, right? So if you have a system in place, yeah, you're going to spend money up front, but then if it's done the right way, if it's, you know, if they solve it the right way for you, then you're technically going to be able to save some money, because, you know, there are softwares out there that I've used, and we're not going to name any names, that really was hard for us, you know, especially, you know, when we transitioned into the whole paperless system.
Absolutely.
You know? And then if you're going to transition from one software to another, that's going to be additional cost, additional training, additional time. You might as well just start from the beginning, right? So yeah, Home Care Home Base, you know, I've seen the system. I've worked with the system for several clients. I do like it. You know, you know, they built it pretty much from the back end of, you know, the discharge going back to the front, rather than the typical software starting off like, what's the process of onboarding?
Right.
And so that was really nice about how Home Care Home Base created that. All right, so you have that one. Pretty much, if for a startup, do you feel that they should have a big office or a small office? And what would be the size that you feel is the right office for them? For a
startup, our first office was literally a 3-person office. It was kind of a shared office. I think there was like one door that went in between it, but literally was like one large cubicle. And it did the job. I mean, honestly, that is basic business principles. Do not overextend yourself. If you have an office where the surveyor can show up and do their 10 chart audits, that's what you need to do. I would not go beyond that. Do not overdo it. Try to spend as little money as you possibly can on an office space.
Awesome. So like, if for anybody who out there who's having problems with their agency right now,
Mm-hmm.
you know, what would be your first thing that you're going to do when you walk into to their company when they decide to use you and try to help them out? What's the, you know, other than, you know, when you walk in, like you're going to make that initial walk in, like what's the first thing that you would look into for their company to kind of figure out the starting point?
The first thing I tend to do, and honestly, I ask this question of every DON and administrator I ever sought to hire, because
Okay.
I wanted to see where they stood with when you, from day one, what's your agenda? But for me, I'm going to do a little mini survey. I want to see, are you ready for the surveyor when they come in? Because those are usually the first key things I want to address. Because if the surveyor walks in the day after I do, are you prepared to handle them, at least from the initial standpoint of when they walk through the door? The second, very next thing I want to address is I want to look at what your money is doing. And it's not because I'm trying to get into the details, it's because your money is telling me your workflow system. That's telling me how you're operating, and if you have some bottlenecks and where those bottlenecks are. Typically, I'm going to find out, do we have a holdup with orders because you're not getting final claims closed? Or do we have a holdup with admissions because you're not getting wraps out the door on time? So those things, that's what I'm going to find out when I look at it. So those are the first two things I look at. I first want to find out, are you going to be ready for a surveyor if the surveyor walks through the door tomorrow? And the second thing I want to find out is what is impacting your finances, and usually it's directly related to workflow.
Like, if you look at, you know, have you ever hired marketers before for your company?
Absolutely. Mm-hmm.
So this is one of the biggest questions I get a lot, is how much you pay your marketers.
Mm-hmm.
So how would, you know, if one of your clients asked you that question, what would you tell them? Would be your answer for that one?
As far as what you should pay a marketer?
Yeah. Like how much is a marketer worth? I mean, I'll give you a quick story, right? So like my best friend, for example, has his agency as well. And actually I started helping him out. He no longer owns an agency. He decided to just become a marketer. And so that was in my realm. And so he used to pay his marketer $65,000 a year, and she brought in an average of 5 patients a month. And that's like mixed Medicare sometimes. You know, sometimes you get a Medicaid thrown in there as well. So what's your, you know, because obviously marketing payment for a home care non-medical marketer is different from a home health, right? So let's go for home health. Like, how much are they worth, really?
For home health, for us, well, in our area, we did not pay. I think our highest paid base salary was like $50,000. Anything over that, you need to earn, period. Because at this point, I have you to generate revenue. And if you're not going to generate revenue for my company, then there's no point in paying you for that.
Yeah.
Now, one of the things we probably didn't do as quickly was our timelines for how long you have to start generating a revenue or generating your quota before I have to start looking at this as a disciplinary action. But I am a firm believer. I've worked in sales myself before, years ago. So I am a firm believer that there needs to be a timeline on how long they have. Generally, it's about 3 months when I'm starting to expect you to hit your regular quota. And then you have about 3 months to hit quota before, or you have 3 months after that of disciplinary action before we have to separate ways. But I feel like you need to earn your keep. Other than that, it's just money going out the door. I mean, the agency cannot absorb that kind of money. Yes, I feel like it's fair to pay you something base so that you can have something consistent coming in. But I feel like to pay you any more than that, you need to earn that. And you earn that by bringing in referrals. If you can't bring in referrals, then you have a problem.
What's the requirement monthly bring in of a 50K?
So our quota at the time was, I want to say it was 16 admissions per month.
Nice.
So that's not just referrals. That's not, because we were getting sometimes 10, 15 referrals a day, but we required you to bring in, that meant 4 admissions a week. So that is reasonable to ask you to make sure. So that means you have to work hard. You have to make sure that you are cultivating that relationship, that you are getting to give you calls, and that they actually turn into quality admissions. We also did not pay for Medicaid referrals after your initial 90-day period. The reason why is because Medicaid is a very low payment source. Even though it's a reciprocal payment source and it works for our business model and helps us continue to grow, it's still on the low end of things. So we want you to go for those Medicare and those episodic referrals, essentially.
Yeah.
And those are the admissions that we pay.
It gets you the Medicare patients to take the.
Absolutely. Absolutely.
So, you're helping the marketers to get Medicare patients, because a lot of agencies are not offering a Medicaid option. And so any agency that does accept Medicaid is going to get more referrals. So, I mean, I truly agree with that. So yeah.
And I can't tell you how many people marketers waste time on the Medicaid referrals, and then agencies allowing them to. Like, if you know that that's not going to be a revenue generator for you as much as the Medicare, you have to be teaching your team not to waste time there. Because the more they waste time there, they're thinking, oh, I'm getting the referral, I'm doing something. It's not doing the job you need them to do. So they need to be focusing their attention on those episodic referrals. They're going to generate revenue for the company.
Totally agree. So, all right. So let's just finalize a few things right here. So let's go over your companies a little bit and what you're willing to do. Because we introduced your company in the beginning, but, sometimes we want to introduce it back in the end as well to
Absolutely.
be really clear things out on how you can actually help people out there. Because that's the main goal here. And, so, your company, just tell us about your company again so that everybody can get the full gist of it and how it's going to be able to help them as an organization. Like what are the problems that you can solve for them is mainly we want to be able to know.
So Nexus is going to solve the problem of your compliance and your income stream from the administrative point of view. Like I said earlier, I believe that oftentimes we focus so much on the clinical, which is definitely necessary. And I have a clinical consultant that I would refer to anyone. But I think we lose sight of how much that administrative process, from marketing to our intake to our scheduling processes, our billing processes in back office, impact our ability to succeed. These people still play the same role in our survey citations as the clinical staff does, and people don't realize that there are some questions on that test that are directly related to the administrative office, and a lot of people fail to understand that. So I want to help your team succeed at that from the back office point of view. I want to help you scale your operations so that you save your money and that you're not overspending in areas where you don't need to, where you can actually see the increase of profit in your company from the administrative point of view, in areas that are just as simple as tweaking process and making sure you streamline workflow and training your team appropriately so that when they're met with hard questions and tough questions, they're helping you succeed as well.
Awesome. So, you're going to do all that for people. So how can they actually get a hold of you?
So our website is nexusmac.com. That stands for Nexus Management and Consulting. I can be reached there. I'm also on LinkedIn, Terrace J. Foster. So you can look me up there, and I can be reached just about in one of those two places.
Any phone numbers that they should know so that they're able to actually get a hold of you, or is that on your website already?
That's going to be on the website.
Awesome,
so yeah.
Awesome. All right, perfect. Well, I just want to say thank you so much for spending some time. I know you have a busy day and you're trying to get the company rolling, getting more patients, and getting more clients. See, I still say patients nowadays.
It's a shift for me too. You'd be surprised.
Clients always. I still say patients, and sometimes my clients are like, "What? I'm not your patient." Well, technically, you are, because you have a problem I'm trying to solve. But yeah. So first of all, thank you so much for spending time with us and stuff like that. So it's amazing. So hopefully, a lot of people got a good thing out of this interview, and so that we can actually keep on giving more value to you guys. So, please look out for more of our videos and podcasts. We really, really thank you for your time. Have a great day. Okay, guys? All right, so it's over. That's a lot of talk.
Thank you very much. Yeah, that's more talking than I'm used to, but.
I'm so sorry. Let's see here. See, I did good. 4:14. We did exactly 1 hour. See? That's
fine. I've got to get used to it myself, but I do appreciate the opportunity. I definitely appreciate that. So you say you're probably going to be launching off your series in November?
Yeah. We actually we're doing an interview tomorrow with call this thing. I don't know if you're familiar with her, Denise Brown. She's the one who started caregiving.com.
Oh, no. Awesome. That's a pretty nice interview.
Yeah, so we have her coming in. We're actually talking to some guys in Access as well, the owner for Access. We're talking about some other people and stuff like that. And so what I'll do as well is, because we talked about the home care home base, like
Mhm.
we can, if you want, you can push this to home care home base, like, well, so these are the things that we kind of do a lot, is like, we're word of mouth and start talking about things. And so that's why I asked a few things about your coding. I don't know if you noticed, I jumped in with, like, what coding, and then you guys
Yeah.
offer those services. I wanted you to be able to open up all the different services that you can and do it more organically rather than just like spitting it out. So
No, that's fine.
all
No,
right.
that's absolutely fine. I appreciate that. But yeah, so we can definitely see about that. I definitely have to see about pushing that. But Access, I've kind of got a relationship back and forth with them over several years. So I mean, we used them for a while. I have a client now that's looking at them again. So
They're
but
gonna
yeah,
pay you, right, for referrals, right?
I'm sorry. Say that again.
Access will give you money for referrals, right?
Yeah, I know they did before. I think once you're not using them, they don't. But I mean, I'm pretty sure they have an affiliate or a partner
No, they
program that.
do. You as an affiliate for, like, you as a consultant,
Hmm.
have a system for that. Like I
Oh,
have
I
it.
didn't know that part.
I have it with several other companies. Like, I have it with Datasoft Logic. I have it, with Point Click Care and stuff like that. So I have several of those, but I haven't done anything with Access. But like, you probably know Betty and them from Access, then, right?
I don't know about Betty. So the way we got into Access, we actually had somebody who initially did our Medicare billing early on, who was
Okay.
working for Access. She's
Okay.
actually out of Chicago, Diane Zelenko. I don't know if you know her or not.
I don't.
Okay, so she's, but yeah, she was doing our Medicare billing early on, and she was working for Access. So it was like right when they were kind of pushing, kind of getting over their hump and starting to get a lot of clients. So that's how we got connected, and I believe she's still connected to them some way or another. But I do know that her and her son were opening their own home health agency in the area at one point.
So who are you
So
using right now for your billing?
I'm sorry for like my internal.
Yeah. Oh,
So
you're not
I'm
doing
doing
that.
every in house right now. So.
So when you start providing billing services for your clients, you're gonna do it yourself, or you're gonna.
Oh no, I have my virtual team that I still work with.
Okay.
So I still that like this was the team that I had built with our agency,
Awesome.
and so they're still on deck for me. They're aware of the transition and just kind of waiting for me to give them a go ahead. So I actually already have one of them is a certified Oasis and reviewer, and actually three of them are certified Oasis reviewers, but one of them is actually a certified coder as well. And then I have a biller who was able to bill. He could bill all of Medicare, and then he also has the Indiana Medicaid knowledge and California Medicaid knowledge. So we'll
So
have that under wraps. So yeah, I have my team together already. It's just a matter of getting those clients and really building it up right now.
you'll get it. You'll get all that.
Yep. I'm excited though. I'm excited. It's a good move. So
It is.
well,
It took. I was laughing. I was looking at my videos. My first upload was 5 years ago.
oh wow.
And it took a while for it to get. It's just
Yeah.
just goes.
Yeah, I think the biggest thing is going to be just kind of jumping out there and really just looking for people. I was talking to even talking to my husband, I think one of the challenges is getting home care agencies, particularly the small agencies, to see the benefit of having somebody operationally to help them. I think they know they have to have a clinical consultant. They know they have to have somebody help them. And then they kind of fall into the founder's trap where I'll just do it myself. I'll just do it myself. So I think at this point, it's really just selling people on, hey, look, I've been through this. You don't want to do this by yourself, because trust me, I've been through, and it's hard. It's hard. And there was a lot of headaches, a lot of sleepless nights, a lot of crying, trying to get through it all. So it's a challenge, but you get to the point where you're like, you know what, I've got something to offer. And even now, my first client now, when we were selling the company, they were at my office like the next day, was like, hey, can I get your help? So they recognized the benefit of it, immediately, and knowing that, I know you guys have done this for 8 years, and I know that, you've got a lot to offer. So they recognize the value. It's just getting quite a few other people to understand the same thing, that, hey, you're going to need this, and you'd rather learn from somebody who's kind of been through it.
Yeah, so that's a good idea. So yeah, perfect.
Yeah.
Well, thank you so much. I'm not going to keep you any longer because I know, you've been like, it's been a long day already. Just 1 hour talking. Like, I have another 200 videos to make after this. So.
Oh my goodness. Well, good luck to you.
We'll take it from there. But thank you so much. I'll put the file in a Dropbox, and then I'll send
Okay.
it send you the link and you'll be able to download it, okay?
Okay, great. Well, thank you so much. I appreciate your time.
Okay, bye-bye.
Bye.
Before we continue on to the video, just need to be able to take a few seconds of your time.
This video is brought to you by one of our sponsors, HomeCareAnsweringService.com. So our job here at HomeCareAnsweringService.com is to be able to make sure that you stop missing any calls, because we're going to handle the calls for you 24 hours a day, 7 days a week, 365 days of the year, even during the holidays. So mostly we're going to be doing a lot of your after-hour calls to be able to give you some time to be able to rest rather than staying up or waking up in the middle of the night to answer any phone calls coming in for your home care, your hospice, or your home health agency. It's also going to be able to help you guys reduce the cost. Instead of hiring a full-time receptionist, especially if you are in the beginning process of starting your business, you want to be able to reduce your costs at this very moment. We are HIPAA compliant. Also, when we want to contact you, we can send you messages via text message, via email, or even via leaving a voicemail in your current phone. Another thing is we are just one price service, right? We don't charge anything different for our after hours on our morning hour calls. Also, remember, we are industry specific. We only work with home health, with home care, and hospice agencies. Also, it's a month-to-month program. We don't have any yearly or 2-year contracts. So you just pretty much pay as you go. Now, we have 3 different plans. Typically, most of the people will sign up with our silver plan, which includes 100 minutes a month, which is $99 a month. And any additional minutes after that is just 95 cents. If you are starting your agency, you can start off with the basic plan, which is $39 a month, and you get a instant 20 minutes per month available for you. This is really good if you're just starting off your agency and you're still working a full-time job and you don't want to miss any phone calls. So sign up at this very moment to HomeCareAnsweringService.com and stop missing those calls.
Everyone, we want to be able to invite you to our 10xPatientReferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xPatientReferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's 2 choices. Go to 10xPatientReferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. Before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xPatientReferrals.com. So sign up for a limited time at 10xPatientReferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.